Have you ever thought that skipping a shower or forgetting to clean certain parts of your body could actually become a life-threatening mistake after age 65? Most seniors assume they're doing just fine with their hygiene. A quick rinse here, a little soap there, and done. Right? But according to top geriatric doctors, there are three body parts that, if not cleaned daily, can turn into breeding grounds for dangerous bacteria that can lead to skin infections, urinary tract infections, pneumonia, and even sepsis. This is not just about looking clean. It's about staying alive and preserving your health during your golden years. In today's video, we'll reveal the three forgotten body parts, explain exactly why they're so risky after 65, and show you how to clean them safely even if your mobility is limited. Stay with us. Your health may depend on it. This is old is gold, where growing older means growing wiser. Let's start with a hard truth most people don't like to talk about. As we age, our bodies don't cleanse themselves as efficiently. Our immune systems slow down, our skin becomes thinner, and our mobility becomes limited. Even our sense of smell weakens, so we might not even notice if we're not as fresh as we think. And when it comes to hygiene, most seniors don't realize that the same routines they used in their 40s or 50s just aren't enough in their 60s, 70s, or 80s. Doctors have found that many elderly patients suffering from recurrent infections could have avoided them with one simple step: targeted daily hygiene of key body areas. So why is this so important? Because harmful bacteria love warm, moist, and often overlooked areas of the body. And after age 65, we're more vulnerable to their attack. Here's what happens. Our skin loses its protective oils, folds, and creases. In the body become deeper. Our immune response weakens. Seniors may sweat less, but retain more moisture in certain spots. And many take medications that suppress natural defenses. It creates a perfect storm. All it takes is one neglected area, and bacteria can multiply within hours, leading to infections that don't just affect the skin, but the entire body. And now, let's talk about the three most dangerous spots. Yes, your belly button also. Called the navels, one of the dirtiest parts of the human body, and it often goes completely ignored. Studies have shown the belly button can harbor over 67 different types of bacterium, many of them harmful. Why is it such a problem? 'Cause the belly button is a small, warm, moist pocket that often goes untouched during bathing. It collects sweat, dead skin cells, soap residue, lint, and dust, body oils. Over time, this buildup forms a thick, smelly bacterial sludge. And for seniors, that bacteria can leak into the bloodstream, especially if the skin is thin or cracked. Infections linked to the navel can lead to fungal infections, skin abscesses, urinary tract infections, and in rare cases, sepsis, a potentially fatal blood infection. How to clean it: use a cotton swab or soft cloth with warm water and a bit of mild soap. Gently wipe inside the navel. Avoid harsh scrubbing or using alcohol. It can dry or crack the skin. After cleaning, dry the area thoroughly. Moisture is what feeds the bacteria. Needed? Apply a light antibacterial cream recommended by your doctor once a week. Many seniors are shocked to see how much dirt comes out the first time they clean their navel properly. Don't be embarrassed, it's common. But from today forward, make your belly button part of your daily hygiene routine. The area behind your ears might seem small and insignificant, but it's another higher risk bacterial zone, especially after age 65. Why? Because the back of the ears produce natural oils called sebum, are exposed to sweat, dirt, and hair oils, and often go unwashed, especially by seniors who avoid bending or turning their heads in the shower. And for seniors with hearing aids or eyeglasses, the buildup is even worse. These devices trap sweat and oil behind the ears, making the area a breeding ground for bacteria, fungus, mites. Over time, this can cause itchy, smelly skin, painful sores, skin infections, fungal rashes, and in some cases, ear infections that travel into the inner ear and even the brain. How to clean it? During your daily bath, use your fingers or a soft washcloth with warm, soapy water. Gently scrub the skin behind and under your ears. Rinse thoroughly and dry completely, especially in the folds. Do you use hearing aids or glasses? Clean those as well to prevent recontamination. Neglecting. This area may seem minor, but it's not. Doctors report many elderly patients developing infections simply because this area was left dirty for too long. A clean behind-the-ear area means fewer infections, fresher skin, and better overall hygiene. This third body part is one of the most dangerous if not cleaned properly under the breasts and within skin folds, especially for overweight or bedbound seniors. Doctors refer to these areas as intertriginous zones, places where skin rubs against skin. They stay warm, moist, and dark, perfect for bacteria, yeast, and fungus to grow. Common locations include under the breasts, in the groin area, under the stomach flap, behind the knees, under armpits, between toes. For seniors, infections in these areas can escalate rapidly. You may first notice redness, itching, a sour or musty smell, discomfort, or burning. This could be intertrigal, a bacterial or fungal infection that often starts as a rash and quickly spreads. In some seniors, these infections lead to skin breakdown, open sores, MRSA infections, fungal overgrowth, candida, fever, and systemic illness. How to clean it? Clean these folds daily with a soft washcloth and warm water. Add a mild antibacterial soap. Pat dry thoroughly after bathing. Don't rub. If needed, use a drying powder like cornstarch or medicated powder to absorb moisture. Wear loose, breathable clothing, preferably cotton. In severe cases, ask your doctor about antifungal creams or skin protectants. Seniors who are overweight or bedbound are especially at risk. If you care for someone in this condition, help them clean these areas every day. Also, use mirrors or ask for assistance if reaching certain areas is difficult. There's no shame in needing help. It's better than risking a hospital visit. Now that you know the top 3 danger zones, let's talk about some bonus tips to make hygiene easier, safer, and more effective as you age. Make a daily checklist. Include navel, behind ears, skin folds, armpits, groin, feet, under fingernails. Check them off daily until it becomes routine. Use the right tools, long-handled. Sponges, non-slip shower mats, gentle cleansers, avoid harsh soaps, mirrors for hard-to-see areas. Stay dry. Moisture is the enemy. After every wash, pat dry gently. Use drying powders. Change into clean, dry clothes. Moisturize smartly. Only moisturize areas that need it, not in folds where it could trap bacteria. Ask for help when needed. If you live alone or have limited mobility, consider hiring a part-time caregiver. Asking a family member, using in-home hygiene services. Staying clean is not vanity, survival. Let's recap. The 3 body parts that must be cleaned daily after age 65 are the navel belly button, a hidden pocket of dangerous bacteria behind the ears, often ignored, and a trap for dirt and oils. Under the breasts and skin folds, the most dangerous zone for infections. Neglecting these areas can lead to skin infections, fungal rashes, urinary tract infections, and even life-threatening complications like sepsis. But the good news, you don't need expensive products or complicated routines. Just a few minutes a day can drastically reduce your infection risk, improve your confidence, and help you enjoy a healthier, cleaner, and longer life. If you found this video helpful, please like, subscribe, and share it with someone who needs to hear this. This is Old as Gold, reminding you aging is not a weakness, it's a victory. Keep winning with wisdom.